Hi guys, so let's start with the question of the day. Question goes like a 50-year-old man with history of recurrent calcium containing renal stones present to emergency department with flank pain and blood in urine. The patient is likely to have which of the following disorders? A. Anemia of chronic disease. B. Chronic Proteus infection. C. Hyperparathyroidism. Or D. Hyperaldosteronism. So in this question, I would like to discuss all the options first. What is anemia of chronic disease? First, you should know what are the important points in anemia of chronic disease. It is due to inflammation. So in inflammation, interleukin 6 is released. What does interleukin 6 do? It increases the hepcidin levels which are released from the liver. This is a PYQ, that hepcidin levels are released from which organ? It is released from liver. It binds to ferroportin on the intestinal mucosal cells and it inhibits the iron transport. In chronic disease, we have SLE and RA. Examples of chronic disease can be SLE and RA. And in anemia of chronic disease, ferritin is increased. It is opposite to iron deficiency anemia. So these are important points of anemia of chronic disease, which includes interleukin 6, hepcidin, it binds to ferroportin. So this is about anemia of chronic disease. So in anemia of chronic disease, nothing is mentioned about calcium stones. What is chronic Proteus infection? Proteus mirabilis, it is an microorganism. So what does it do? It causes infections in urine. It causes UTI. The stones are known as struvite stones. Staghorn calculi, it can be also called. It is composed of three things. It can be learned by a mnemonic map. From M you have magnesium, A ammonium, from P you have phosphate. And very important question, that it grows in alkaline medium. Alkaline medium is present. You can see this is staghorn calculi, like a staghorn. These are staghorn calculi, very large calculi, which are seen in Proteus infections. Okay, so now in Proteus infections, yes, there are stones, renal stones are present, but not calcium containing. It is made up of MAP, magnesium, ammonium and phosphate. So cannot be the answer. Hyperparathyroidism. What are parathyroid glands? Parathyroid gland releases PTH. And what does PTH do? PTH tries to maintain the levels of calcium and phosphate in our body. So it is a very famous mnemonic which we study from the second year, that in primary hyperparathyroidism there are stones, thrones, groans and psychiatric overtones. It is also written in Robbins. From stones you have calcium stones, thrones you have polyuria, groans means the patient will groan with pain. It is abdominal or flank pain and constipation. But the very important point is this constipation, it does not respond to laxatives. And psychiatric overtones, there are many neuropsychiatric disturbances. This is a PYQ. What is the most common cause of hyperparathyroidism? It is parathyroid adenoma. And in AIMS asked one step ahead, what is the best test for parathyroid adenoma? It is technetium-99 system EB scan. So this is about primary hyperparathyroidism. Stones, thrones, groans and psychiatric overtones. So this is about primary hyperparathyroidism. So in this, yes, primary hyperparathyroidism is the answer, because calcium stones are present too with flank pain and blood. History of recurrent stones are there. Now what happens? What are the lab values? What will happen to calcium level, phosphate levels, ALP levels in primary hyperparathyroidism? So what does parathyroid do? So parathyroid hormone, it increases the calcium levels. It reabsorbs all the calcium from the bones to come into the circulation. So definitely it increases calcium. And also you know that calcium and phosphate have a balance to maintain. So if calcium is rising, phosphate has to decrease, PTH will increase. It's given in the question. And what is ALP? ALP, it is a bone marker. So when there is increase in PTH will try to destroy your bone. When the bone is being destroyed, all the ALP will release. Bone marker is that. So ALP also increases. So this is in primary hyperparathyroidism. Now you tell me in comment section, in which condition both calcium and phosphate both rises together. It is somewhat related to vitamin D. As you know, D, it has dual function. It increases both calcium and phosphate. You tell me a disease in which both calcium and phosphate both are increasing, but the PTH level is low to normal and the ALP levels are also normal. So the question is, in which disease calcium increases, phosphate increases, but ALP is normal and parathyroid is also normal. So this is a question. What is the fourth option? Hyperaldosteronism. Aldosterone has nothing to do with calcium stones or anything of that. So this option you can easily rule out. So yes, the answer becomes C. So this is the question of the day. Thank you guys. See you tomorrow with another question. Thank you.